Happy 2025, everybody! After I put out the nutrition marathon, it was requested of me to do the same thing for the canine and feline osteoarthritis series, so that's what I've done this week. As arthritis impacts the vast majority of our cats, this information is absolutely crucial for you to know. I hope you enjoy it. If you need a refresher or if you've never seen it before, next week VMC will be back to its regular scheduled programming with one topic per video.
Hello, welcome to VMC. I'm Dr. M. Today we are going to discuss feline arthritis. We will start with discussing what seems to cause most of the arthritis for our cats, what symptoms you might notice with cats that have arthritis pain. So join me, you'll learn something today. Today's topic is one that I am particularly passionate about. This is because pain is often undertreated in veterinary medicine, especially if we're talking about chronic pain. And then we also know that cats receive far less veterinary care than our dogs do. And so they are treated even less well when it comes to pain management, and especially when it comes to chronic pain management. There are many reasons that contribute to this, and we'll delve into those a little bit more later. But for now, let's discuss what arthritis is. So in this video, I am discussing osteoarthritis. This is different from rheumatoid arthritis, and it is a type of chronic pain that is progressive and that affects the range of motion of the joints, and as time passes, the animal using their joints less, and because of that reduction in usage, they lose muscle mass, which makes the joints less stable, which leads to more pain, and it becomes this very vicious cycle. From the research studies that we have, over 90% of cats by the age of 12 will have arthritis pain. And there was one study that showed that even 90% of all cats of any age will have signs of arthritis in at least one joint, and it's actually especially common in their back, but it could be any joint on their body. And so by the time a cat reaches 7 years of age, you can be fairly confident that they have arthritis that requires pain management. So what tends to be the most common cause or contributing factors for arthritis in our cats? For dogs, as we discussed in the video series for dog arthritis, we know that most commonly we are discussing a secondary osteoarthritis. This is very different from our cats. With our cats, it's most common that they will have what we call primary osteoarthritis. So there are no clear underlying contributing issues causing arthritis in the majority of our cats. Now, don't get me wrong here. If a cat does have hip dysplasia, like can be a bit more common in certain breeds, say like the Maine Coon, or if it's a cat that has a luxating patella or has had trauma, that absolutely can cause arthritis in a cat as well. It's just that most of our cats won't have any of that in their medical history, and yet they still have arthritis forming in their joints. Most people that have cats will have a domestic short, medium, or long-haired cat. However, there are going to be some people that do get a purebred cat. All the breeds with the folded ear pinna develop osteochondrodysplasia. This leads to a progressive, genetically based osteoarthritis that is absolutely crippling. Arthritis lesions can be seen as young as 7 weeks of age. 7 weeks. They are babies and they already have arthritis. By the time these cat breeds are 6 months, they will likely have significant osteoarthritis formation in their joints. This is a huge welfare concern. We should not be supporting these cats. They are being bred for a lifetime of pain and suffering, and since they live in pain from such a young age, the amount of pain that they are feeling is very often missed. They're commonly described as quiet kittens. What's actually going on is that they're experiencing a significant amount of suffering, and they have been for their entire lives. Chronic pain is a welfare concern for any and all animals of any species. And when we're describing cats in general, they are often harder to catch in order to start treating for a variety of reasons. Let's delve into that now. First, people don't know what to look for. People are on average a bit better at reading dogs. The dog will start to limp. With a cat, because this is most likely to be primary osteoarthritis, it very commonly affects them bilaterally. That means both sides of the body. So they are going to be a lot less likely to limp. This means that people don't pick up on the fact that their cat is having joint pain. Cats also have fewer muscles in their face, and so their expression when they are having pain is more subtle, especially if you don't know what you're looking for, than it is for a dog. People also have a lot of misconceptions about how cats are very independent and how they can be fiery or spicy or grumpy. And all of these descriptors are often cats that are actually in pain and it's not being managed. Compounding all of these issues, our cats sleep and groom and rest for a lot larger a percentage of their day than our dogs do. On average, a cat will sleep about 40% of a 24-hour period, and they will spend an additional 22% of their day resting. They also spend a fairly significant chunk of time grooming each day, and all of this whittles down the time where people might see their cats being active. Fewer people take their cats outside for safari-style walks than they do for dogs, and so they're unlikely to catch when their cat has a reduced ability to exercise. People also assume that when a cat is slowing down, that this is simply old age. And I really want to drive home that old age is not a disease. Our cats do not wake up each day and think, oh, I'm 7 years old, I should act like it. They don't have that perception. They act how they feel. Cats also see a veterinarian less often on average than a dog does. And this means that there are fewer chances for the veterinarian to pick up on signs of chronic pain and try to address it with people. Because cats tend to leave their houses less often than our dogs do, by the time a cat gets to a vet clinic, they're often quite stressed out. And so they're hunched down, they don't want to move, they don't want to walk around, they're certainly not jumping around places like they would be at home. And so as a veterinarian, I don't really get much of a chance to see how your cat walks, jumps, trots, grooms, etc., because they're just too nervous to do any of those behaviors. So it's very hard for me to pick up in a clinical setting if your cat is experiencing pain. And if they are painful, when we're doing our physical exam, they are so tense from being fearful that they will not react if there's any chronic pain going on in an area of their body that we are investigating. All of these things combined together explain why cat pain is much less commonly caught, addressed, and properly managed and treated. I have done a previous video on pain in cats. I'll make sure to link that video in the description for you as well. If you are looking for more information about felines and pain in general, you can check that out. That said, when we're considering arthritis pain, I would look carefully for a cat that has reduced their activity in any way. That might mean they hesitate before jumping up or jumping down from things. They might start missing jumps that they used to make with ease. They might change the routes that they take. Instead of doing jumps that they used to do, they might take a different route in order to avoid doing those large jumps. A cat that is not painful should easily be able to jump from the floor to a counter and back down again without hesitation or any issue. Cats that are unable to make jumps of that height are probably dealing with pain. You might also see a change in their grooming habits. If they're dealing with pain, often they'll be grooming less, so you see a rough or an unkept hair coat. It might just even be in one specific area because they're losing some flexibility, so they just can't reach it very well anymore. On the flip side, because cats can't ever be simple, some cats will start to groom areas that are painful a lot more in an attempt to give themselves some comfort. If they are over grooming, you might see a loss of fur. They can even create skin sores. Cats with chronic pain will also tend to sleep more. You might also see a change in appetite. Your cat might become picky or eat less, start to lose muscle mass, start to lose some weight. You might notice your cat starts house soiling. If they end up having to do a flight of stairs to get to a litter box and they're really sore, they're not going to do that flight of stairs anymore. Your cat might stop greeting you like they used to. They might not want to be picked up as much as they used to. They might not want to cuddle with you as much as they used to. Any sort of behavior change like that can be indicative of chronic pain. You might also notice that they're restless during times where they used to sleep soundly. If they're in enough pain that it's disrupting their sleep, people will sometimes start to complain that the cat has started bothering them overnight or vocalizing. There are many other reasons for that as well, so you'll have to work with your veterinarian to rule them in or out. Cats might also hide more, or they could just become a bit grumpy, where you end up warning people to leave your cat alone where they used to really like socializing with people. I know that these are quite subtle changes, and of course they can be caused by a variety of different reasons, but ruling chronic pain in or out is a crucial part of the diagnostic process here. So the next question becomes, how do we diagnose this? Well, by the time osteoarthritis shows up on x-rays, it is already quite advanced as far as the disease process goes. The appearance of the joints on x-ray does not correlate well with the pain that the cat may or may not be feeling. X-rays can look completely normal and the cat can still be experiencing a significant amount of pain. Doing a physical exam, often a senior blood work panel to rule out a bunch of issues that can cause similar symptoms, maybe checking some x-rays, maybe seeing an orthopedic specialist. Sometimes we might end up needing to do some advanced imaging like a CT or MRI to check for other issues that could be causing pain, like a disc problem in a back or more subtle signs of disease that just don't show up well on x-rays. But if you've been through all of that, the next step that many veterinarians miss doing is a trial of pain medication. This is so important. I cannot stress this enough. If your cat has not received a 2-week trial of pain medication, you have not checked for chronic pain in your cat. As arthritis pain tends to be so gradually progressive, it's so easy for people to miss it. It's not until you see that change after they've been on medication where you'll realize that yes, they were in pain. Next week, we will be covering the common treatment, medication, and supplement options that we have. So keep an eye out for next week's video. Bye for now. Hello, welcome to VMC. I'm Dr. M. So now that we've addressed the common diagnostic steps for diagnosing osteoarthritis in cats, we need to move on to treatment to help manage our cats that are dealing with arthritis pain. So join me, you'll learn something today. Now we have less research for our cats than we do for our dogs. cats are absolutely not small dogs. They're very different species. However, when we don't have any research on the cat species specifically, we do the best we can with the information we have available for other species. Now, the specific treatment options for your cat will vary based on your ability to give medications to your cat. I did do a video on how to teach this. You can find that in the video description. It will also depend on your cat's temperament, your ability to consider things like injections over oral medications, what your budget is, what your schedule is, and so on. I'm just going to cover some of the most research-based and common treatment options we have. The treatment plan must be multimodal. All cats require that. Early and aggressive intervention is key. We want to catch any joint pain as quickly as we possibly can, because the better we're managing it, the less muscle mass they're going to lose, the less their quality of life is going to suffer, and that will help them to maintain range of motion, muscle mass, activity levels, and their quality of life for longer. If there are any other disease processes that could be contributing to the formation of osteoarthritis, like hip dysplasia or patelloluxation and so on, those must be addressed first. Now, we don't have any research in the cat species showing that them being overweight causes arthritis. However, the extra weight will increase the forces on their joints, and abnormal forces on joints will make those joints more painful. So if your cat is a body condition score of 6, 7, 8, or 9, getting them to lose weight and get down to a body condition score of 5 out of 9 is so very important. Reducing the forces that they need to put on their joints will enable them to use their joints better and to experience less pain when they do things like playing and jumping. Healthy weight loss for cats was actually one of the first videos that I did. It's particularly tricky for cats as they can mobilize fat to their liver and get a hepatic lipidosis if weight loss is done poorly. So make sure that you check out the video I did on feline weight loss before attempting to get your cat to lose any weight. The intervention that we have the most research on for controlling chronic arthritis pain in cats is using non-steroidal anti-inflammatory drugs. Hands down, this is the most research-based intervention we have. We even have more recent studies showing that using NSAIDs in cats that have kidney function issues is generally safe. And we also need to think about how quality of life is much, much, much more important than the quantity of life for the cat. It is unfair not to treat their pain due to a concern for potential organ function changes. However, especially in the US, for some reason, there is this real hesitancy about using NSAIDs in cats over the long term. As we get more research in this area, it's truly showing how we can safely use NSAIDs long term in senior cats. Using NSAIDs is an absolutely key intervention for your cat. If your veterinarian will not prescribe NSAIDs for your cat, you need to see another veterinarian. It is not acceptable to leave your cat painful. You absolutely must discuss with your veterinarian how you understand there can be some risks with using NSAIDs, but that the quality of life for your cat is the most important consideration here. That is the key takeaway. We did discuss in the canine arthritis video how Adequan can be used in order to help support the cartilage in the joints and to improve the quality of the joint fluid. This essentially means that there are better cushions between the bones in your cat's joints. Now, there isn't research in cats for Adequan. However, using it off-label for cats is done all the time. That being said, the body of research on Adequan isn't entirely conclusive, so this is an adjunct medication, but for some cats, if it's helpful, it can be a very useful one to use. Generally, you start by giving the injections twice a week for a month, and then you wean down to once a month. It will depend on how your cat responds to the Adequan injections, and so you'll need to discuss if Adequan is an appropriate choice for your cat or not. Your veterinarian can help to guide you. For cats, we also do have a newer product called Silencia. It is an anti-nerve growth factor monoclonal antibody designed for the feline species. This class of medication interrupts pain signals, and so your cat feels less pain. It is a monthly injection, and many cats respond very well to it. As it is a newer medication, we don't have research about how this medication is going to do over the long term, but the information we do have at this point is very promising. We can also use gabapentin and pregabalin for cats. This can be a helpful option because the longer pain exists in the body, the more likely there is that a neuropathic component develops. Gabapentin and pregabalin are commonly used for chronic pain for that reason. Now, it may not be successful for all cats, but it is an option to discuss. Buprenorphine is an opioid-like medication that we can use for pain. It can be very helpful for cats. For chronic pain, we also have amantadine. This can be incredibly beneficial for some cats, so you can discuss it as a possibility with your veterinarian. Tramadol actually seems to be able to help with pain for cats. Our dogs aren't able to metabolize tramadol to use it for pain, but our cats do seem to be able to. The problem with tramadol is that it can be quite bitter, and for that reason it tends not to be used all that often. NSAIDs are the first go-to intervention to consider when we need to add medication for pain management. It's as the arthritis progresses that we then start to add in additional medication options to the NSAIDs. This leads us next to the world of supplements. The supplement with the most research behind it for cat arthritis pain are omega fatty acids. The fatty acids bind in the cell membrane and help to prevent inflammatory pathways. Now, this does take a couple months, so adding omega fatty acids will not have an immediate effect on your cat's comfort, but it may be helpful over time. We do have a number of prescription joint diets that we can use. We have JD from Hills, and we also have Mobility from Royal Canin. These diets do have research behind them showing that they help with pain reduction. Now, there are going to be some cats that won't be able to switch to one of those diets for a variety of reasons. And so in that scenario, your veterinarian might recommend orally supplementing omega fatty acids. But this gets a little complicated because the nutraceutical industry is kind of a hot mess. And so what's on the label doesn't necessarily match what's inside the product. And we also rarely have bioavailability studies from the companies. So make sure to get a specific product recommendation from your veterinarian if you're going to be supplementing omega fatty acids. You may also gradually have to increase the dose as it can cause some GI upset or diarrhea. And there may be some cats that have other medical issues where it's not appropriate to add omega fatty acids. So make sure that you talk to your veterinarian before you start adding any supplement to your cat's diet. We also need to make certain that the omega fatty acids are from fish oil, krill, that sort of thing, as the vegetable-based omega fatty acids do not seem to be bioavailable for our cats. We have very little research on glucosamine and chondroitin for cats. In dogs, the research shows that glucosamine and chondroitin does not reduce pain. At the very best, maybe it's slowing down the arthritis formation, but even there, the jury's still out. We don't know for sure. Adding glucosamine and chondroitin for pain management is absolutely not acceptable. It's only a consideration as an adjunctive if you already have everything else implemented and you still have some budget to spare, I will have a number of resources for additional reading for you in the video description. I would love to hear from you about what has worked best for your cat or what you learned today. I do put out a new video most Fridays, and so I look forward to seeing you in the next one. All right, bye for now. Hello, welcome to VMC. I'm Dr. M. Today we are going to discuss environmental modifications that we can do to help manage our cats that are dealing with arthritis pain. So join me, you'll learn something today. Implementing a physio, rehab, or conditioning routine could be a wonderful option for your cat. We do have rehab veterinarians who have specialized in rehabilitation that would be very helpful here. They often will consider things like underwater treadmills to take some of the weight off the joints while still encouraging muscle use and range of motion maintenance. Not all cats are going to be accepting of these sorts of treatment modalities, and the stress of taking your cat to a rehab facility might be too high. It could be a better option to get an at-home routine to work on some balance and conditioning and muscle maintenance, as well as to help maintain your cat's range of motion for their joints and to reduce the amount of compensating that they do with their bodies. Once they get painful in a certain area, they will compensate how they move because of the pain, and that can lead to pain in other parts of the body. This is why working closely with a rehab team can be beneficial for your cat. I will link in the video description a canine conditioning group that's very research-based. I know they talk the majority about dogs. However, they do have some fitness experts that also work with cats and that put out information for feline fitness and feline conditioning classes. It is absolutely crucial that modifications are made within the home when your cat has arthritis pain. Most commonly, this means adjusting the amount that they need to jump. You can add stairs or ramps. Those things can make a lot more of your house a lot more accessible for your cat and reduce the pain they feel trying to get up to the spaces they feel safe enough to rest in. Cats do really need elevated resting and sleeping areas, and if they're painful, they will struggle to reach them. So you need to modify their route to get up to those areas. We also need to consider adding things like a heated cat bed, as warmth can be quite soothing for chronic pain. They'll quickly tell you if they like that or not. Or adding kind of an igloo type bed style for them can also be helpful, as it will keep them a little bit warmer. This also means you might need to adjust the style of food puzzle that you're offering for your cat. They might need it made a little easier, or they might need a different type of food puzzle in order to reduce joint pain. You can also cut holes into the walls of your litter boxes so that they don't have to jump over or even step over a lip to get into the litter box. And doing the rest of the litter box husbandry that I discuss in my litter box husbandry video is key. You will need to make sure that your cat easily has access to food, water, toys, resting areas, and litter boxes in every area of your home. If they have to go a significant distance or do a lot of jumping or running or stairs, or if they are worried about getting by other pets that are around, they will not access the resources as often because they're painful, so they're avoiding that movement. And that will result in them losing weight or becoming dehydrated or house soiling and so on. So you need to increase the number of resources your cat has available in order to make it very easy for them to access the resources they need. You might also need to experiment with changing the orientation of the scratching posts that you have available to your cat. If they used to use a lot of scratching posts in a certain orientation, implementation that might now be painful, and making modifications might encourage them to continue scratching. Them doing that scratching is an important part of their behavior. It also encourages stretching and range of motion for the joints in their body. You can also consider using things like catnip and silver vine, etc., in order to entice your cat into doing a bit more movement or a bit more scratching. It will also be very important that you implement everything you can in order to reduce stress for your cat. When any species is stressed, that worsens the pain that they feel, and chronic stress will worsen chronic pain. So keeping their schedule the same, giving them safe spaces for if company comes over, all of those sorts of adjustments will be crucial. I want to add a note here that not every veterinarian will have the tools in the toolbox in order to help you fashion a multimodal treatment plan that is fitting the current standard of care. There's so much research that comes out all the time, and things change so often. Not a single one of us can keep up with everything. We also, as individuals, have things that we like and dislike, and areas of practice that we're more and less comfortable with. So do not hesitate to be a strong advocate for your cat. Bring in video of the changes that you notice. Discuss the decrease in mobility and activity that you are seeing at home. Make sure that you advocate for your cat, and if your veterinarian is not able to help you, you may need a second opinion, and that's totally fine to do. You may need to be referred to an orthopedic specialist. That's also totally fine to ask for. Make sure to be the voice your cat needs, because they cannot tell us how they are feeling, and we need to be very aware of any small changes in them so that we can best address any pain that they might be feeling as they are aging. Because osteoarthritis is a progressive disease, it's also crucial that you are doing regular quality of life assessments. I will link in the video description a video I did discussing quality of life. This is an important thing to think about. There will come a time where we are doing every single intervention we can be for your cat, and there will come a time where that is no longer enough. This could be because of arthritis. It could also be from a variety of other issues. When we get to that part, it's so important to be discussing humane euthanasia. We don't want our cats to suffer. Euthanasia can be such a lovely gift that we can give to them in order to relieve the constant suffering and the decline that they would otherwise experience. It's not an easy topic to talk about, but it's one that we have to be aware of and to think about. I also want you to remember that because this is a progressive disease, when you see your veterinarian and the first part of their arthritis treatment plan is implemented, hopefully that will be enough to help manage your cat's pain for a significant period of time. But as the arthritis progresses, interventions will need to be added in order to maintain your cat's quality of life. This is normal. Don't just get the NSAIDs and think, okay, this is it, we're done. Arthritis treatment plans must be multimodal in order to be most effective, which is everybody's goal. Please look in the video description if you're wanting any additional information. Thank you for joining me today. I would love to hear what you learned from today's video, or if you have a topic that you would like me to cover in the future. I'd love getting the comments, and I'm happy to add any suggestions to my list for future video topics. I do put out a new video most Fridays, and so I look forward to seeing you in the next one. All right, bye for now.